let's talk about the most common cause of hair loss in women, which is the genetic part. And androgenic alopecia is driven by testosterone. And it's important to know that all women make testosterone. Everybody thinks that's a male hormone, but women make testosterone as well. So we're going to talk about two parts of androgenic alopecia. One, where the normal androgen or testosterone levels are normal. And again, this is part of the genetic. And that also comes into play when we talk about hormone replacement therapy later on. And again, elevated androgen levels can occur in polycystic ovary syndrome, which is very common in our younger patients. Also, oral contraceptives and IUDs can create an elevated androgen level, and we'll talk about that. And then hormone replacement therapy, depending on what a woman is taking, can create elevated androgen or testosterone levels. So androgenic alopecia, or genetic or female pattern hair loss, this is the most common cause of hair loss in women. It used to be called female androgenic alopecia, which to me made better sense because it actually refers to the causes of this type of hair loss, which is both the hormone as well as the genetic predisposition. There are multiple androgens or testosterones that circulate in our bloodstream. We hear mostly about testosterone, but there are others such as DHEAS, which is a precursor to testosterone. And then DHT, dihydroxytestosterone, which is the culprit in androgenic alopecia. The testosterone gets converted to the DHT, and then the DHT is what affects the hair follicle. And the picture to the right, the top row is men, but the bottom row is women. And it really is the progression of androgenic alopecia. It doesn't progress as rapidly in every person. Everybody's different. And the type of where the hair loss is occurring can vary from woman to woman. Again, important to understand that all women produce testosterone, not nearly as much as men, but enough to be a problem if it's too high. So the incidence of androgenic alopecia, when you do any research, it says anywhere from 20 to 50%, which is a huge range anyway. But actually, I think it tends to be even higher than that, particularly as women age, especially after menopause when our estrogen and progesterone levels drop. So in androgenic alopecia, as I mentioned before, you have normal levels of testosterone, which are converted to DHT at the level of the cell. So at the hair follicle, the testosterone, which is circulating in our bloodstream, gets converted to DHT, which is the culprit. It's the hormone that actually attacks the hair follicle. It blocks the growth, and it causes miniaturization or shrinking up. The hair follicle actually becomes smaller, and the full-size hairs, which we call terminal hairs, become shorter, thinner, and turn into what we call vellus hairs, which are really baby hairs. Now, the big question is, we don't know why certain hairs are affected and others are not. This may be genetically predetermined. There may be something different about each individual that makes certain hairs more affected than others. So again, this is the process that takes place. In androgenic or female pattern hair loss, these predetermined DHT-sensitive hairs continue to get smaller. And as you can see in the picture on the right, the follicle gets smaller, and so as the follicle gets smaller, the hair it produces gets smaller. So over time, as the hairs are getting thinner, they don't provide enough coverage, and so you result in decreased density. And so these hairs also, unfortunately, have a shorter anagen or growth phase, as you recall when I mentioned before, which again, if you shorten that growth phase, it accelerates the miniaturization or the shrinkage of the follicle. Unfortunately, as each new hair comes in, it's a little bit smaller. Eventually, some of the follicles will stop functioning and will no longer produce a hair, and then you really start getting spaces. But initially, what it is the hairs themselves are getting smaller, so they don't cover as much. You might have just as many, but they don't cover. But over time, if left untreated, then you will start to lose some. So why does this happen? So now, if the androgen levels are normal in most women with female pattern hair loss, why does this happen? We don't know all the answers to that question. Genetics very likely plays a big role in that. younger women presenting with female pattern hair loss tend to have a very strong family history in both the men and the women of their family. People think that it has to come from the men. In fact, it can come from the women. It can come from both sides. The genetics and the inheritance pattern for female pattern hair loss is not that simple. I find that the young women that I see, women in their late teens and early 20s, most of them have a dad who has, pretty profound advanced balding at an early age. And unfortunately, that gets passed along to their daughters. The incidence of female pattern hair loss increases dramatically as women approach and then pass through the menopause, again, presumably due to a loss of estrogen, which does affect how much testosterone is circulating. Estradiol is the most active form of estrogen, and that's the one that decreases with age. And it's the strongest form of estrogen. Estradiol and progesterone are the main female hair hormones. And there's a chart to the right, which shows that the levels increase. It's on the bottom one. They increase to about age 35 to 40, and then they slowly decrease. After menopause, they're very, very low. In some women, it's barely measurable past menopause. Interestingly enough, the testosterone levels in women also increase rapidly to about age 25. They increase significantly during puberty. And then they gradually decrease, but they don't decrease as much as the estradiol decreases, which is an interesting fact to keep in mind. Whoops. Okay, sorry about that. Now, the estradiol drops 75 to 80% after menopause. The testosterone drops only about 20 to 25%. Therefore, that ratio of testosterone to estradiol increases with age. Even though both levels are lower, the ratio, unfortunately, results in less estradiol protection. This is not good for hair. Hair loves estrogen, does not love testosterone. So even though the levels of both have decreased, the estrogen levels decrease at a much more rapid and much more profound rate. And unfortunately, this ratio, which is not in favor of estrogen any longer, does accelerate the female pattern hair loss. Estrogen is good for hair. Just to show you the levels, estradiol, which again is the most potent estrogen in our bodies, premenopausally, it can vary significantly between 30 to 400 nanograms per deciliter. Just to give you some idea, it does vary within our cycle. It increases just before our periods, mid-cycle, just before we ovulate, and then estrogen decreases after that, but it does cycle throughout the month. Postmenopausally, those levels drop from anywhere to 0 to 30. Now, if you look at pregnancy, that level shoots way up to 15,000. And so we all know most women have thicker hair during pregnancy, and estradiol is one of the reasons. Unfortunately, we lose that, which again then can cause shedding postpartum. We also know that if postmenopausal women take HRT, hormone replacement therapy, with estrogen, the testosterone levels do fall. So estrogen does play a strong role in controlling our testosterone levels. And as we lose that control, the testosterone levels is unopposed. Now, having said that, we do not advocate for HRT only for treating hair loss. I don't ever recommend that as the only reason for doing HRT, because there are some potential side effects due to HRT. I think I just moved this along a little too fast. Sorry about that. Okay, next slide. So what is the treatment for female pattern hair loss if we want to talk about how androgens play a role? Should that be part of the treatment? And the answer is most of the time, yes. Primarily, if we want to talk about anti-androgen therapy, premenopausally, spironolactone is a medication which can help block the testosterone. Oral contraceptive pills can also help block the testosterone. And we'll discuss that a little bit more later, because there are some birth control pills that are very good for hair, and there's some that actually are bad for hair. The other medication that we use only for postmenopausal women is something called finasteride, and we don't recommend it all the time, but in some cases we do. Finasteride is a medication used for men who are balding. It does work really well for men. It's not as effective for women, but it's something that needs to be considered. And what it does is it blocks the conversion of that testosterone to DHT. And again, DHT is the culprit. So again, anti-androgen therapy may be a part of the full treatment program for any woman, excuse me, with female pattern hair loss. And we also consider minoxidil, low-level laser therapy, and PRP, or optimal platelet concentration therapy, which some of you are familiar with, and we've had webinars discussing that in the past as well. Supplements can also play a role in having some anti-androgen benefits.